Did you know that yesterday was National Tooth Fairy Day? It's a day dedicated to getting kids excited about taking care of their teeth and to teach them that losing baby teeth is a part of growing up. And today I'm joined by Prince George's County native Dr. Arlene Asante to talk about the importance of dental hygiene from a young age. Thank you so much for joining us,
Yes.
Dr. Asante. How are you today?
I'm amazing, and I'm so excited to be here to share something that I love and I'm so passionate about.
Great, great. So for those parents out there of young children, how can you get your kids excited about dental hygiene, forming those dental habits?
The most important thing is to share it like an opportunity for the child to see that this is fun. And this is about taking care of yourself. The earlier, the better. I think a lot of times when we wait longer to take our children to the dentist, it kind of formulates fear in the child. But when we take the child when they start getting their teeth and just continuously to take the child every 6 months to the dentist, it kind of eases the fear and it kind of becomes a routine or a day-to-day lifestyle. And that's what we're trying to cultivate in the child, is to share to them that dental care is a way of life.
And what is a good age to start your kid on a dental routine and taking them to the dentist?
I say as soon as your child starts having teeth, which is commonly on the bottom area, I would start taking them to a dentist, a pediatric dentist, so they just can get used to the environment, being used to someone being in their mouth, looking at their teeth, and applying fluoride treatment as well. So as soon as a child starts teething and you start seeing teeth, that is a good opportunity to take the baby to the dentist, because a lot of abnormalities can also be seen at an early age as soon as the child starts to have teeth.
Are there any differences between children's dental health and adult dental health? Are they more susceptible to things like cavities?
I would say everybody is susceptible to cavities, especially based on your diet. If you're eating more candy, high fructose, high sugars, and then you're not brushing and flossing and having those day-to-day hygiene habits, you are susceptible to cavities. Age is not a factor at all. It's primarily your diet. Yeah.
And what are some misconceptions that you see people having about dental health?
I think the biggest one is if it doesn't hurt, I don't have to do anything. And I tell my patients all the time, that doesn't mean just because something doesn't hurt, that doesn't mean that something is going on.
Right.
I always give the example, Uncle Johnny, one day, everybody thought he was healthy, and he was running one day and just, bam, he had a heart attack. And he went to the hospital, and his doctor probably told him multiple times, hey, something's going on. But Uncle Johnny felt like, well, I feel great. It's the same thing with dental care. If you go to the dentist and your doctor has identified something as cavities or decay, infection, and your doctor is instructing you to take care of the treatment, I highly recommend to go ahead and follow your guidelines by your doctor. And just because it doesn't hurt, that doesn't mean that nothing is wrong.
Right.
Yeah.
Okay, good to know. And not just children, but some adults too are still scared to go to the dentist, or they just get nervous. So what are some tips to kind of calm those nerves down?
I would say primarily think about your health. I think in today's society, so many people are concentrated on self-love, self-motivation. A lot of people are going to the gym. We just saw a take about new food habits at the restaurant. So healthy living is a big thing. So I think when we think about I need to do this for myself. I need to overcome the fear. Just like on a day-to-day, we are fearful of a lot of things. So we shouldn't allow fear and bad experiences stop us from living a healthy life. And it includes your oral health. Yeah.
When it comes to those oral health hygiene routine that we're trying to instill in our children, is it a good idea for parents to kind of give their kids incentives to, brush your teeth every night, floss your teeth?
Yes, absolutely. Like I said, I tell parents to make it a fun activity. Like every morning we're going to go brush our teeth. You can use music. You can use alphabets if you're trying to help the child with with learning the alphabets or numbers, using music, using siblings, making it a race, who brushes their teeth the longest, which is you should be brushing 2 to 3 minutes. So using those texts, those little nibbles or different hints to help improve and empower the child. So make it an empowering moment, not just something you have to do or like a routine. Make it something that you're doing something so great and we have to reward you. And that essentially you're building healthy habits in the child.
Right. Okay, great. You know, something you're looking forward to, right?
Yes.
All right. Well, thank you so much, Dr. Asante, for being here with us today.
Thank you so much. And I hope these tips help people in our community.
Yes, definitely.
Thank you.
For more information on Dr. Arlene or her practice, visit firstclasssmiles.com.